Welcome to our show. Our topic today very well could be the health and wellness discovery of the 21st century. It has only been truly available in the United States and the rest of the Western world for less than a decade, yet it's already one of the most popular nutritional supplements in the world. I'm talking about the global phenomenon that is Noni Juice. Hello, I'm James Jameson. My guest today is truly one of the world's foremost medical experts on Noni Juice. He's a Johns Hopkins hospital-trained physician with both an MD and a PhD. He did research and taught on the medical school faculty at Johns Hopkins Medical Institutions and at the University of Maryland School of Medicine, where he held the positions of Assistant Professor of Medicine and Associate Professor of Physiology. He also enjoyed a brilliant medical career that spanned 3 decades. My guest is a New York Times best-selling author and for 18 years wrote a global medical column for the Los Angeles Times Syndicate. He has dedicated nearly 10 years of his life to the study of Noni Juice. His published findings have sold more than 1 million copies worldwide. When he is not studying Noni Juice, he serves as a pro bono health consultant and advisor to the International Council of Caring Communities, an NGO of the United Nations. I'm pleased you could join us today, Dr. Neil Solomon.
James, it's my pleasure.
Thank you. Dr. Solomon, as I mentioned in your introduction, you've enjoyed a brilliant 30-year career as a health professional and researcher and author. Given that background, what interested you in finding alternative medicines as opposed to traditional medicines, or is there something wrong with traditional medicine?
There's nothing wrong with traditional medicine. I was trained in traditional medicine. I love traditional medicine, but there's more to medicine than just traditional medicine.
Yes.
There are other areas that can complement traditional medicine. And the thing that really got me into the study of Noni was the fact that I saw a lot of patients in the hospital and out of the hospital who were getting ill because they were taking medications. Now, medications are important to take. You need to take your medications, but you should take the least amount that will do the job. And sometimes you can take food supplements and that will allow you to take less medication and therefore you'll have less side effects. So with this open-minded attitude that I have, I decided that it would be very interesting to see if we could do something with natural healing.
That's good, Dr. Solomon. Now, with all of the natural remedies that are out on the market today, what was it that ultimately caused you to select Noni Juice? And what is Noni Juice anyway?
The reason I selected Noni Juice was in 1996. I was an editor of a health journal, and we looked into new aspects of health and medicine. And the publisher asked me, he said, Dr. Solomon, do you know anything about Noni? And I said, well, no, what is it? He said, well, that's what I want to know what it is. Can you find out? And I said, sure. So what I did is I called my friends at Johns Hopkins. Not one of them heard about it. I called my friends around the world who are professors of medicine in high esteemed, prestigious hospitals and medical schools. Not one of them heard about it. And I came back and I said, I can't find anybody that heard anything about Noni. But in my study of the literature, I did find the name Dr. Ralph Heineke. And so I phoned up Dr. Ralph Heineke and I said, Dr. Heineke, this is Dr. Neil Solomon. I'm looking into Noni. What can you tell me about it? And first, he said, well, a little defensive. He said, well, wait a minute. What do you want to know about Noni for? I said, well, I think it's interesting. From what I heard, it helps lots of people for lots of different things. And that opened him up, and then he started telling me about it. And he said, yes. He told me all the things that they help for, from headaches to arthritis to cancer. You name it, it didn't help. And I said, well, do you know anybody I can talk to in the United States who can tell me about it? Somebody who's taken it and they could tell me really what they felt. And no problem. And I got a name, and then from that person I got other names, and then from that person got other names, and pretty soon I had a stable of people who were telling me about Noni. And it did help. According to them, it helped them from cancer, heart disease, arthritis, rheumatism, sexual problems, all the way to stroke. And each of them had their own particular problem, and each of them told me their own story. And they were fascinating stories. To name a few of these people, there was Ken and Mary Rowland, where arthritis was a problem. There was Dell and Sylvia Williams, where heart problems were a problem. These are either problems that they had or knew people who had them. There was Drew and Maeva White, and they had cancer problems. There was Mark and Joe Rosen, and they had infectious problems.